So, as you mentioned that you are 25 years old, you're young, you're malleable, you're millennial, and you want to start therapy, but you are a little conflicted, if I may, that should you go to therapy or not? So tell me, should I go to therapy even if I don't have any real major issues, no trauma history, or nothing to really rant about? The answer is yes, yes, and yes. Everybody can go to therapy. Watch this video till the end to know why you should go to therapy, why somebody else that you know should go to therapy, and why therapy should become such a commonplace thing that there is no real stigma about going to therapy anymore. Hi, my name is Dr. Era Dutta and I am a consultant psychiatrist and a therapist. I practice primarily mindfulness-based CBT practicing techniques. I am a big advocate for therapy, and as a psychiatrist who's trained to do therapy, I get a lot of questions about therapy. So I decided to make this video addressing the most common FAQs about therapy. So let's dig in. So first of all, what is therapy? You know, people think therapy means just baat karna, just gupshup marna, just adda marna, just aapne bola, maine suna and tata bye bye, and that's 1 hour of money. No, it isn't. Now, understand that therapy is an umbrella term that we use for describing the various therapeutic alliances that there are. Matlab, ways in which a therapist and you will get together. आपको कोई क्लास नहीं मिलेगी in which you will get together to create a better dialogue about mental health, emotional well-being, balanced lifestyle, and so on and so forth. So, therapy or psychotherapy comes from the Latin word actually. Therapy means to heal and psycho means the soul or the psyche. जब हम साइकोथेरेपी यूज़ करते हैं ज़्यादातर लोग काउच के बारे में सोचते हैं, but over the period of time I think the couch is really redundant. Most people do not use it. Some people may still use it and you may get to lie down. Most people don't even want to lie down. But yes, therapy has become an umbrella term for many things. So dig into this video to further address and understand that what kind of therapies exist, who does therapy, why do you need therapy, what can therapy help with, what can therapy not help with, what should ideally be the template for therapy, and what should not be considered therapy. So obviously I'll also talk about the traits that you should look for if you're looking for a therapist, and definitely I think therapy is something that you can invest in if you'd like to develop self-growth, if you have clinical condition, if you don't have clinical conditions, even then. So how is therapy conducted? Therapy can be conducted in person, face-to-face, or it can be conducted virtually online. That is called teletherapy. Now, in person, you are going to need to come into the therapist's office, or the therapist may do a home visit for you in certain cases. Also, I know that it's very popular to go sit in a cafe with a therapist. I don't think it should be done. I strongly believe that those are against the boundary system. So I am very rarely use the word should so definitively, but should not have therapy ongoing in a cafeteria or in a Starbucks. चलेगा नहीं, क्योंकि इतने लोग होते हैं स्टारबक्स में, राइट? कोई आपकी बात सुन सकता है. It's not really this thing anymore when I'm like, you know, in a Starbucks talking to you and और बताओ, it's a friendly chat, right? So if you have a therapist who wants to call you to Starbucks, just say that Dr. Dutta said that in her video that it's not the most professional ambient place, and if you want your therapist to come to Starbucks, know that it's not the most ambient place for therapy, right? Now let's talk about therapy में कितने sessions लगते हैं. How many sessions do you need in therapy? There is no fixed number. There is no ideal number. Honestly speaking, the first couple of sessions may actually be just about learning to develop rapport with each other, meaning learning to sync with each other. ऐसा हो सकता है कि आपके therapist आपकी भाषा सीख रहे हैं और आप उनकी भाषा सीख रहे हैं. मतलब language is similar, but you're learning each other's vibe. So the first 2 sessions do not judge your therapist. Your therapist is also still taking notes to understand more about your personality, more about the instances that have happened in your life, and more about who you are as a whole. Now, each session typically would last anywhere between 40 to 60 minutes. Every therapist has their different time slats. For example, some people work in 30-minute slot, some people work in about 50-minute slot, some people work in about an hour and a half slots. Everybody is different, but average 45 minutes to 60 minutes is a therapy session for most people. Now, coming to how often does one go to therapy? Again, कोई standard template नहीं है. जब crisis हो रहा होता है तो therapist आपको प्रति सप्ताह भी बुला सकता है, every week भी बुला सकता है, हफ्ते में 2 बारी भी बुला सकता है. But everyday therapy is not something that I personally believe in. I see the point being redundant unless you are traveling away and then you can't have the contact, so you're doing a lot of sessions back to back. So that's my humble opinion. But you may have to see the therapist in the beginning, maybe once in 10 days or 7 days, and then you can start seeing them once about 3 weeks, and then move on to seeing them about once a month, and then gradually even wean it off to maybe once in a couple of months. So on an average, a person may require at least 5 to 8 sittings with a therapist. Again, everybody is different. Take my answer with a pinch of salt. ऐसा नहीं है कि ये standard template है, but it is a good practice to think about that as a ballpark figure or number. तो अब आई बात कि थेरेपी कौन करता है, who does therapy. Now, in India, the concept of therapy is still evolving. We often think that this is a Western concept. Not true. There is history behind therapy. In our country, actually, therapy has been ongoing for donkey years, for many, many eons, in different formats. In fact, we love thinking of our family as a unit where we get a lot of therapy from and wise insights, if I may. But when it comes to in India, who does therapy? First are therapists. Now, therapists could be your counseling psychologist, your clinical psychologist, psychiatrists do therapy who are trained in it. And for example, I do CBT or cognitive behavioral therapy. The newer terminologies that people often use are coaches, life coaches. Now, life coaches do not do therapy, and I will come to what they do in another video perhaps, but that is not therapy, that is coaching or life coaching. Now, therapy जो है एक ऐसा प्रोसेस है जो मैं आपको समझा नहीं सकती जब तक यू हैव नॉट बिन थ्रू इट. मीनिंग इट्स नॉट लाइक वन फिट टेम्पलेट, just one set template fits all. Everybody's experience is so unique in therapy. Everybody's subjective experience is different. Why are we still hesitant about going to therapy in India? पहली बात है, कुछ तो लोग कहेंगे, लोगों का काम है कहना. दूसरी बात है कि हमें ऐसा लगता है कि हम अपने सारे इश्यूज खुद ही सॉल्व कर लेंगे. वी डू नॉट नीड एनीबडी, वी डू नॉट नीड एनीबडीज हेल्प. नॉट ट्रू. वी नीड अदर पीपल्स हेल्प. व्हाई इज इट दैट वी आर ओके विद गोइंग फॉर अ मैथ्स ट्यूशन? आई कांट डू मैथ्स ऑन माई ओन, आई एम एबल टू एक्सेप्ट दैट. व्हाई इज इट दैट वी रियलाइज दैट हमें अपने दांत के लिए डॉक्टर चाहिए, हमको नाक के लिए डॉक्टर चाहिए, आंख के लिए डॉक्टर चाहिए. बट when it comes to mental health, notice we all think that we know ourselves so well that we do not need anybody's help. We need to be changing that. We need to be constantly coming across to challenging that. So टेलीथेरेपी एक ऐसी चीज़ है जो कि पैंडमिक में बहुत ज़्यादा पॉपुलर हो गई है, एंड इट मीन्स कंडक्टिंग थेरेपी वर्चुअली ओवर दिस मीडियम. फॉर एग्जाम्पल, यू आर सिटिंग इन अ डिफरेंट सिटी और प्लेस एंड वी आर कनेक्टिंग ओवर आइदर अ वीडियो चैट, मोस्टली video, some people do audio as well, where you can speak to a therapist in a different time zone, time, place, and it's really, really popular, and I will make a video on teletherapy altogether, because what it does is bridge the gap between the need and the demand and supply, because there's so many people who stay in remote places in India which may now have better network but do not have good therapists. So it's something to definitely think about. तो कैसे issues resolve होते हैं therapy में? What kind of issues are resolved in therapy? A unique umbrella of issues can be tackled in therapy. There's relationship counseling, where you can definitely get into talking about relationships. There's depression that can be handled, anxiety that can be handled, psychosis that can be handled. There could be just problems of adjustment, problem of life, problem of that stage where you don't know how to make the right choice. There could be parental trauma, there could be childhood trauma, there could be abuse, there could be some kind of physical manifestation. For example, there's somatic therapy which deals with pains and aches. So there are many kinds of therapy. Notice, when I say the word therapy, I do use it interchangeably with counseling. Typically it's not, but then ideally for most average people, वो लोग counseling और therapy को एक समझते हैं, तो वो साधारण तरीके से इस्तेमाल किया जाता है. मुझे पसंद नहीं है यूज़ करना, बट ज़्यादातर ऐसे ही इस्तेमाल किया जाता है. Now, हम एक और वीडियो बनाएंगे, मगर मैं पहले जानना चाहूँगी आपके सवाल क्या है थेरेपी के बारे में. जैसे कि मुझे बाकी जो पॉपुलर सवाल लोगों ने पूछे हुए हैं कि हाउ डू आई गेट समवन दैट आई लव टू गो टू थेरेपी, हाउ डू आई कन्विंस माई पार्टनर टू गो टू कपल्स थेरेपी. थेरेपी जो है उससे मेरे को बेस्ट निकालने के लिए क्या करना चाहिए, ये सारे सवाल. दवाई की ज़रूरत है कि नहीं, what else can be added along with therapy, ये सारी चीज़ें हमें एड्रेस करनी है. मगर मैं और सवाल जानना चाहूँगी जो आप जानना चाहते हैं मुझसे. लीव इट इन द कमेंट्स बिलो so that I can make another therapy video where I address more FAQs that you have asked. Coming to some popular myths about therapy, I love finishing with myths and some popular things that people have said to me and I have laughed. Retail therapy is not therapy. your best friend is not your therapist. Nuh-uh, they're not. They're just not. They may know you really well, and that's the problem. You can't have therapy done for your best friend. You can't be your best friend's therapist. Emotional conflict होगा. एक और जो प्रॉब्लम है, अगर आपको कोई मेजर डिसऑर्डर नहीं है तो आप थेरेपी पे क्यों जा रहे हैं? यू कैन गो टू थेरेपी इवन इफ यू डोंट हैव अ मेजर डिसऑर्डर. Therapy is only for crazy folks. ये वर्ड ही अच्छा नहीं है. Therapy is for everybody. If you have a mind, you have mental health. If you have mental health, you can go to therapy to think of it like गाड़ी की सर्विसिंग. अगर आपके पास गाड़ी है तो आप सर्विसिंग करा सकते हैं. Mind is that car. You can go for servicing, refreshing, cleaning, oil change and so much and so forth. Finally, डियर ज़िंदगी एक ऐसी मूवी है जिसमें थेरेपी के बारे में बहुत कुछ बोला गया है. मैं सोच रही हूँ थोड़ा सा डियर ज़िंदगी पे एक वीडियो बनाऊँ, तो क्यों ना आप मुझे कुछ पॉपुलर सीन्स या डायलॉग भेजें और वो नीचे लिखिए. एंड आई वुड लव टू मेक अ रिव्यू अबाउट डियर ज़िंदगी बिकॉज इट्स द फर्स्ट इंडियन मूवी विच पॉपुलराइज्ड एंड टॉक प्रॉपरली अबाउट थेरेपी. शाहरुख खान एंड आलिया भट्ट. सो दैट वाज the therapy 1.0. I'll keep making videos around what is therapy and questions around it so that I can keep dispensing some valuable information. Do hit subscribe, share this video, check out some of the other videos. One of the most interesting videos that I've made is actually on ChatGPT and mental health, and the other is on this viral tweet that went pretty viral and it was about stigma against psychiatrists. I'll see you in the next one. My name is Dr. Era Dutta. Bye.